Hello everyone, Dr. PK from Dr. PK Life. And I have one of my follower is asking this question. My blood sugar before bed is 6.2 millimole per liter, but when I wake up at 5 a.m. is 6.7 millimole per liter. My A1C is 6.0%. Is this dawn syndrome or something else? The short answer is it could be very well be the dawn phenomenon. And here is, I think this is what's going on here. Between 3 a.m. and 8 a.m., your body naturally prepares you to wake up. And it releases hormone like cortisol, growth hormone, glucagon, adrenaline. And these hormones tell your liver to release stored glucose into your bloodstream so you have energy for the day. If you have diabetes or pre-diabetes, your body may not produce enough insulin or may not respond to insulin well enough to keep that extra glucose under control. As a result, your morning blood sugar may be a little higher than it was night before. Look at these numbers. Bedtime, about 112 milligram. Morning time, about 121 milligram. A1C is 6.0%. These are actually excellent numbers for many people with diabetes or pre-diabetes. An A1C of 6% corresponds to an average blood sugar around 125, 126. So I would be much happier seeing these numbers than someone waking up with a reading of 9, 10, 11 millimole per liter. But could it be something else? There are three possibilities. Number one is dawn phenomenon. It's the most common one. Blood sugar slowly rises before you wake up because of natural hormones. No overnight low blood sugar. This is generally harmless if your overall diabetes is well controlled. Somoji effect, much less common. This happens when blood sugar drops too low overnight and then body responds by releasing a stress hormone like cortisol and adrenaline to overcorrect, causing the higher morning blood sugar. And we know today that it's much less common than once believed. Number three could be late night eating, a large dinner, dessert, snacking before bed, alcohol. All of this can contribute to higher morning readings. So how do you know which one is which, right? The easiest way to check your blood sugar around 2 o'clock or 3 o'clock in the morning, or even better, you can use CGM, continuous glucose monitoring. A CGM records glucose every minute throughout the night. It can clearly show whether blood sugar is stayed stable or slowly climbed or dropped before rising again. This gives much better information than a single finger stick. Can you reduce dawn phenomenon? Sometimes yes, but you have to talk to your healthcare provider. You have to start eating dinner a little earlier. I would say before sunset. Avoid late night carb. Light exercise after dinner. And reviewing your medication with your doctor to make some adjustment. And optimizing your insulin if you're taking insulin. My advice to the viewer is this. Your numbers actually look fantastic. And A1C 6.0% means you are doing many things right. A small increase in the morning overnight is really not something you should worry about itself. Instead of focusing on the number, look at the overall trend. A1C, time in range, if you're using CGM, daily glucose patterns, and how you feel. Okay? Those tell us much more than single snapshot morning blood sugar reading. The bottom line, if your morning blood sugar is just little higher than the bedtime reading, don't panic. It may simply be your body's normal hormonal response called dawn phenomenon. If your A1C is well controlled, your morning sugar aren't exactly excessively high, you are likely on right track, And if you're unsure, then you talk to your doctor and start using cesium or overnight glucose check, and that would clarify the situation. You know? So have you noticed your blood sugar is higher in the morning and bedtime? Could be dawn phenomenon. And let me know your bedtime and morning glucose numbers. I may feature one of your videos. Follow Dr. PK Life, Dr. Karan, Dr. PK for evidence-based diabetes education that's easy to understand.